Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Mary Ramon. She's a counselor and certified coach. Today's Kevin MD article is How Doctors Can Turn Criticism into Collaboration. Mary, welcome to the show.
Thank you so much for having me on the show.
All right, so briefly share your story and then talk about the Kevin MD article that you shared with us today.
Absolutely. I'm a licensed mental health counselor, and unexpectedly, I got into healthcare. For the past 20 years, I've been working in healthcare. I used to manage the employee assistance programs, which are like counseling programs for employees on site at two academic medical centers. And then for the past 9 years, I've been exclusively coaching physicians. So I learn a lot from the challenges they face and their unique ways of solving them.
All right, and what are the most common issues that these physicians come to you with?
Burnout. A lot of times physicians don't need help with their communication skills, they just need rest.
Hmm.
But also I help with communication skills, stress management, just how to be most effective in the environment that they're in. And one thing that I've noticed is that physicians, I've learned this, they get interrupted a lot and they get a lot of unsolicited suggestions and critique. And that can be challenging and really put them on the defense. Is that something you've noticed, Dr. Foe?
Sometimes I could definitely connect with the interruption part, right? It's very difficult for physicians to have a continuous train of thought before getting interrupted, whether it's a phone call or a knock at the door.
Yeah,
I think there's just so many concurrent things that are going on in a typical physician's day.
great.
Now, in your Kevin MD article, How Doctors Can Turn Criticism into Collaboration, and you mentioned that physicians get a lot of unsolicited feedback. So tell us what your article is about for those who didn't get a chance to read it.
Absolutely. So physicians get a lot of unsolicited feedback, and defensiveness is completely normal. Turning it into collaboration is extraordinary. And that's what the article is really about, is how we can shift the mindset from defensiveness to openness. And that's not just about being nice, it can actually indirectly improve outcomes, patient safety, because when we're approachable,
Hmm.
people are more likely to point out a near miss, ask an important question, maybe make a good suggestion that makes things better. So that's the main gist of it.
Now, from your experience and when you talk to physicians, who is giving them this unsolicited feedback, and what are some examples of some of that feedback that you've heard?
Good question and good point, because they're getting suggestions from a lot of nurses, and it's shared decision making, right? And nurses are encouraged to speak up, and they're getting suggestions from young residents, and they're getting suggestions and criticism from the family and people who have less or limited training, and they already have a plan for the patient. And so, one example I can think of, if it sort of brings it to light, is there's a resident and an attending. They were dealing with a complex ICU case, and the resident suggested stopping a particular medication. And the attending thought that that was premature.
Hmm.
And instead of reacting defensively, she said, "Why do you recommend that?" And he explained that he just read a couple of research articles about it. He gave some case examples. The attending continued the medication, but she said, "I'm going to go home. If you send me the article, I'm going to read it tonight." And their relationship changed from tense to collaborative. And I love seeing those kind of shifts.
I love that story that you shared because instead of getting defensive, that attending approached that situation from a standpoint of curiosity, right?
Exactly.
And that turns that relationship, I'm going to guess, into a more collaborative one.
100%. It's not always easy to do, but if you can make that shift, it's a wonderful thing. And so, in working with the physicians that I coach, there's an analogy that I use that for whatever reason, many people have told me this is the main thing I remember from working with you. And I'm like, really? So that's what inspired me to write the article, is because I have a very simple analogy, but it sticks with people.
That's not always easy to do, right? Because sometimes, no one likes to hear negative feedback or criticism, right?
Yeah,
So
right,
when
right.
you coach physicians,
Yeah,
how do you get them to kind of lower their guard and make them less defensive or reactive and
yeah.
kind of approach that situation differently? How do you teach doctors to do that?
Well, lower their guard when they're working with me. First of all, I need to commiserate. Who am I? I have never practiced medicine and I've never walked a day in their shoes. So they need to tell me all the reasons why it's hard to take the suggestions, and those are valid reasons. And and I need to validate that the defensiveness is normal. And that's how I get them to rant about it a little bit, and then we kind of take a shift, and it's like, what's a different way? How do you think you might approach it next time? So, in terms of the analogy, would you like me to share the analogy, Dr.
Sure,
Fo?
of
Okay.
course.
So, the general idea is to treat suggestions as gifts,
Hmm.
because I feel that when someone's giving a suggestion, they feel like they're giving you a present, even if it's not wanted, especially if it's not wanted, because that's when we're quick to toss it away in medicine. But if someone gives you, this isn't my analogy yet, this is a different one, but if someone gives you, let's say, an ugly sweater or
Hmm.
something, right? Are you going to say, I hate it, I'm never going to wear this, it's useless? No, what are you going to say?
You're
You're
going to,
going to
of course, appreciation.
Yeah. So in general, with suggestions, start with appreciation. At a minimum, say thank you. Being open to suggestions is not the same thing as going with the suggestion. And I want to be really clear about that. And so this is the analogy. Imagine that I'm holding an apple in one hand. I really like apples. And someone hands me a pear.
Hmm.
The pear doesn't cancel the apple. The apple doesn't cancel the pear. They coexist in that moment. So if someone gives me a pear, that's a gift, right? Even if I don't like pears, it's a gift. And I say, thank you. And then with the tone of curiosity, like an eager learner, I say, tell me more about pears. What's your experience with pears? Why are you recommending them? And why are you recommending them? And then at a minimum, you listen and you can say, well, I can see why you're recommending pear. In this particular case, I'm still going to go with apple, but I'm going to keep this pear in my pocket for later because I might be able to use that. And so it's the whole apple and pear analogy that has just stuck with people.
So if physicians or clinicians continue to be defensive when receiving unsolicited feedback, tell me what that perpetuates. What are some of the consequences of that?
That's an important question because I see that a lot. And worst case scenario is a medical error, I think.
Hmm.
Second worst case would be written up, which happens unfortunately too often, but it shuts down ultimately the collaborative environment. And so approachability is super important for patient safety. And like I said earlier, it's not just about being nice. The physicians I work with, they say when they're interrupted, for example, they say maybe 50% of the interruptions are valid and the other 50% aren't. And it's frustrating, but at the same time, they need that 50% that are valid, So when, they realize that, because you said worst case scenario, they miss out on the ones that are
Hmm.
important, especially because they're not being approachable or open. And then people aren't going to point out when they see something wrong necessarily. They might be afraid to ask something that they think is a stupid question that's really a vital question. And so that's how it can affect patient safety. And also, people are sensitive, it's 2025. And depending on the way it's handled, unfortunately, physicians sometimes get written up for these interactions. So I help them prevent that or turn things around.
Do you have a success story that you could share? And of course, it doesn't have to be a real client. It could be an amalgamation of your previous clients where you've coached them to be more curious about feedback and talk about and do some of these approaches that we've talked about today? And what were they like after? Maybe give us a before and after picture after implementing some of these techniques that we've talked about today.
I have someone in mind, and I'm not going to give too much information, but this person makes me smile. This person did not want to start working with me. He was actually kind of sent to work with me and wasn't too happy about it, which is understandable.
Hmm.
And in general, I think he got in trouble for the way he was handling criticism or suggestions in the workplace. And yeah, so I think he was very misunderstood. All the physicians I work with are good people and they're speaking up about important things, and he's definitely a good person. But first of all, he's someone who really loved the analogy and said it just shifted things for him. And I know that when the physicians I'm working with are happier and they tell me that they feel happier going to work and the people around them are happier and it's like a more positive environment, that things have really shifted and clicked. And they tell me, like, once they start implementing these things regularly and it becomes a habit, because it's a little uncomfortable at
Hmm.
first, but when it becomes habitual, it's that overall happiness at work and more collaborative teamwork. And they tell me it even spills into their personal lives, which is something that happened with this physician. So he's actually the person who inspired me to write the article and reach out to you.
So we've talked about, of course, this approach to better accepting feedback and turning it into a collaborative moment. Give me some red flags. What are some things that physicians absolutely cannot do when receiving feedback that causes them to get written up, for instance? What are some red flags, absolute things that physicians should not do?
I mean, I don't, they may seem obvious, but you don't want to raise your voice.
Hmm.
You don't want to say, what do you know? You haven't been trained. You don't want to
And that
just,
happens, right? Physicians really do say that, right?
yeah, 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 yeah. I mean, there's swearing, there's just obvious stuff, right? Or just like, even just turning your back and ignoring the person, it's less than ideal. Some people will actually put their hand in the person's face. So these are things, it's probably obvious. I think most physicians don't do these things, but
Well,
even
sometimes
just,
it isn't. You've literally heard or seen a physician put their hand to a person's face, like that actually happened.
I mean, give the hand like
Like
this,
that,
not
yeah.
touching, but giving the hand.
Yeah.
Yeah, like that.
Wow.
Yeah, yeah. And I've been given the hand too. So I know what it's like to be on the receiving end. So I think just, some physicians actually touch people, you push them away. But I think those are the rare cases. The more common cases is just the human reaction, which I would have too if I were being criticized and I already had a plan. It's normal. And that reaction is usually just, they feel their muscles tense and they lean away from the person and maybe they don't make eye contact. And it's not necessarily that they're doing anything wrong, but it's an opportunity to do something right. So it's less about getting in trouble or that sort of thing. It's more about, how can I make this better? How
Hmm.
can I turn this into something not defensive and more collaborative? And that's really extraordinary when people are able to do that. I admire their ability to do that. Not easy in medicine.
Now, sometimes physicians are in a position where they're the ones having to give feedback. What kind of
Yes.
tips do you have for these physicians to give feedback in a more collaborative way and, of course, not raise any defensiveness in the recipient? What are some tips for that?
Excellent question. Praise in public, criticize in private whenever possible. We can't change the past. So rather than berating someone for something that happened in the past, try to state it in the future. So there's future positive if then. In the future, if you set up the instruments in advance and we look at the trait together, then we'll have everything we need if something goes wrong, right? That sounds much better than, you didn't have the instruments ready. You never have the instruments ready.
Hmm.
So that sort of thing, phrasing it in the future can be helpful. And just saying, the expectation is, or we're expected, versus you, avoiding the word you. You can
Hmm.
say you if you're complimenting someone, but it's better to avoid it if you're criticizing someone. So also to make it kind of neutral, there's something called observation, concern, question. Observation is I noticed that the last three cases started late. My concern is it sets us behind for the day and has a ripple effect. And then you ask an open-ended question beginning with what or how. Like, what are your thoughts on how we can
Hmm.
improve? And then help that person be part of the solution.
We're talking to Mary Ramon. She's a counselor and certified coach. Today's Kevin MD article is How Doctors Can Turn Criticism into Collaboration. Mary, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Absolutely. So openness really encourages input. And if someone gives you a suggestion, especially if you don't want it, smile, nod, and say thanks for the pair.
Mary, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you for having me.